So you might have seen on the news, you might have thought about it. In any case, irrespective of where you work, you only have to Google loneliness later life. You get all these images up of lonely old people sat on benches in rooms on their own. So image-wise, it brings up those pictures. And in the headlines, it generates headlines. So good old Daily Mail talks about an epidemic of poverty and loneliness amongst the elderly. I don't particularly like the word elderly, but that's the newspaper word. And then there was a report by MPs supported by the Campaign to End Loneliness, very good campaign. They talked about the MPs highlight the plight of millions of lonely older people in 2012. Then this is a new phrase, I haven't heard of the silver splitters. Loneliness of the silver splitters, rising old age pension divorces leaves more elderly people facing an unhappy old age dependence on carers. Daily Mail again. And there's plenty of these headlines, you can find them very easily. And then loneliness twice as unhealthy as obesity for older people, study finds in The Guardian. That said that you're more likely, 17% 14% risk of dying early if you were lonely, and only a 7% risk of dying early if you were obese as an older person. What they didn't say, it's a bit odd for The Guardian, was it's a 19% risk of having an early death if you lived in poverty as an older person, which is significant. So loneliness is not good. Obesity isn't as bad as loneliness for an early death, but poverty is worse. Worth bearing that in mind. And we think the issue is very important. We published that report down the bottom there, the Lonely Society in 2010. I'll come back and talk a bit more about what that says in a few minutes. We've done sort of focus work on particular groups of people, including older men who are at risk of becoming isolated, depressed, lonely, and other areas of work that I'm responsible for at the Mental Health Foundation around mental health and later life. And I expect most of you will have heard of us. We're a charity. We do service development and social research work. We're not a service provider, but we work with service providers to hopefully help them develop their services, develop what they provide to people. We place a lot of focus on lived experience of people with mental health problems. We work across the life course, and I'm responsible for the work we do around mental health in later life, including dementia, and also work we do around mental capacity, but I'm not going to be talking about that today. And my background prior to the work in the Mental Health Foundation is working in and managing mental health services, so I've got sort of familiarity with service land in that sense. So one thing we'll be careful about when we talk about loneliness in later life is being slightly careful about language, because a number of words like isolation, being alone, solitude, living alone often get kind of muddled up with loneliness, and hermits like solitude and like being alone, but they aren't necessarily lonely. In fact, their raison d'etre is to be alone. People like walking or doing outdoor activities alone. So solitude, being alone, isn't necessarily a problem. I think just coming out the Christmas season, one or two of you may have thought you wanted quite a lot of solitude from family at times over the Christmas period. So there are positives around these words, including isolation. People can be isolated, but not necessarily lonely. Whereas loneliness clearly is a subjective experience, it's a negative experience, it impacts upon our sense of well-being, has negative impacts on good mental health, and as we'll see, has significant effects which may lead to mental health problems. And a couple of ways of thinking of loneliness is it's the gap between what you actually desire in terms of social relationships and what you actually have. So where you want to have a set of social relationships but you don't have them, then arguably you'd be defined as lonely. So you can be lonely in a care home, you can be lonely in this room itself. It doesn't necessarily mean about being isolated, it's about a range of different factors. And one other definition that's quite important to remember is around older people later life. We're all living longer because of the so-called baby boomers, those people born immediately after the war, and also my generation, born in the late 50s. There are more people living longer, so we've now got 12,000 centenarians living in the UK. There were about 2,000 in the 1980s. One of the fastest growing groups of the population are people over the age of 85. The average life expectancy is now, for men, I think it's something like 82, for women it's 87. So what we're seeing is the traditional definition of what is old, which was defined historically by retirement age, 65, that's meaningless now because we don't have a retirement age. You might think of 65 as becoming old, but there's no requirement now to retire at 65. Again, the so-called baby boomer population, we've done some work researching their views about growing old. They don't consider themselves to be old at the age of 59, 60. They see their life in their 60s as a continuation of adult life. So there are different definitions of older people. And obviously there's a subjective definition about how old we feel. That's important to remember. And when you think about the numbers of people, increasing numbers of people who are in their 80s and 90s, we have two generations of older people as well. So if you take sort of late 60s or 60s as where people are retiring, thinking of old age, they may well have parents in their 80s and 90s. So old age is becoming stretched and expanded, and it's no longer a simple definition to say, oh well, it's people who retire, they live for 10 years, they may or may not go into a care home. That's how we define older people. So we have to be careful there about definitions.